The implications of drug abuse are far-reaching and devastating. It affects not only individuals who are users or traffickers, but also families and society as a whole. The alarming increase in drug abuse globally and also in Nigeria is a pressing concern with significant implications. Experts are therefore emphasizing that tackling vulnerable drug users require a compassionate and multifaceted approach. Welcome to 30 Minutes on NTA News 24. I'm Lydia Samson. Our first report by Thomas Ogbetere is x-raying some of the consequences of drug abuse, including and especially implication on health, addiction, overdose, and chronic diseases. There is also the issue of mental health, depression, anxiety, psychosis, amongst others. Let's get more from Thomas.
Drug abuse has emerged as a pervasive menace in Nigeria, posing significant challenges to public health, social cohesion, and economic development. Data from the National Bureau of Statistics indicates that approximately 14.3 million Nigerians between the ages of 15 and 64 abuse drugs, presenting about 14.4% of the population in the age bracket.
And in a lot of the people that get into drug abuse starts by trying to cut corners and trying to make ease ways. You know, things can be difficult and you want things to be a bit easier, and then before you know it, you are abusing drugs. Some are intentional, some are not unintentional. There are unintended consequences of medications that can culminate into drug abuse. It could be maybe because of some certain ailments you start, and then before you know it, now the ailment is gone, but you got addicted to a certain drug, and then you continue to take that drug until you abuse it.
Well, the statistic we have now is the one of 2018, which was conducted by the UN together with the National Bureau of Statistics. And that is a statistic which is called the valid statistic we're using. From that report, or that survey report, it shows that it's a high prevalence of drug use and trafficking in the country. Of course, we are told by that research, which is the only empirical and validated research work so far, that 14.3 million Nigerians between the ages of 16 and 65 use drugs. And that's a very high one.
There's a lot of dysfunctional family relationship as a result of substance use, because a lot of people feel left out, while other people feel being used or being deceived, because substance users are really manipulative and not intentionally. It's because of the way the circuitry in the brain has been changed, so they've lost control of their usual activities. They are not able to do things the right way.
Must have been more than that. Yeah, and then we've seen recent use of drugs, not just the conventional ones that we can mention, but even non-conventional drugs that people can sit in their comfort of homes and use. So which is a major problem for me when we talk about drug abuse as it relates to children.
Now, it's everywhere. It's being sold on the road. So the police have to really come into it also. They shouldn't allow it only at the hands of NDLE. So that's why I say it's a crisis.
These statistics underscores the devastating widespread nature of drug abuse, highlighting challenges relating to addiction, health consequences, and socioeconomic implications are profound. This is because they are ranging from increased crime rates and violence to health complications such as HIV/AIDS transmission and mental health disorders, kidney and liver problems, as well as dementia, just to mention but a few.
I saw a patient who has sickle cell disease, sadly. Because of the painful crisis, she began using pentazocine, to curb the pain. But the use got out of hand, so instead of going to the hospital to get pentazocine, and she's not even supposed to do that, she's supposed to have a hematologist who manages her pain. She went on to the drug medicine stores around, got pentazocine by herself, kept on injecting, and she got ulcers all over her body. So there were some ulcers around the elbow joints. The ulcers ate deep into the joint and finally destroyed the joints. And she had an auto amputation of that arm. You would think at that point she would stop, but she didn't. She continued injecting herself with pentazocine, continued injecting on her foot, and then she had an auto amputation of her ankle joint and then the foot fell off. So somebody without an arm, without a foot, is supposed to stop, right? But she didn't. That's because she has lost control. She continued, and she had more ulcers, and the ulcers became gangrenous, meaning that the tissues were dying and they were smelling, decaying, and even her family had to throw her out.
Last week I was somewhere in Abuja. I saw one beautiful woman walking in a hurry. I called her. I realized she's into drug. I spoke with her. She has already gone mad. But he has not thrown away her clothes yet. But she's in the process of doing that. There's really a big menace.
I've seen that most bandits, the bandits, the insurgent groups, or the Boko Harams, as well as even the domestic violence, they all use drugs. So it's something that we should be worried about. And of course, you have seen the impact as well in families. When one person in a family uses drugs, it affects the whole family. And we have even seen where a child will carry arm against his or her own parents simply because he's been deprived or is not being given enough money to buy drugs to use. So these are some of the impacts that we should be worried about.
The National Drug Law Enforcement Agency at this year's International Day for Drug Abuse and Illicit Trafficking said the agency is proactively working to cut drug supplies, deny users availability and access, revealing that between 2021 and 2024, the agency has arrested over 52,000 drug traffickers. Already, 9,000 of the suspects have been convicted, with a recorded seizure of 7.6 million kilograms of assorted illicit substances.
The NDLA has initiated WADA program, which is War Against Drug Abuse. And the essence of it is to galvanize the public, particularly the grassroots people from the family level to traditional rulers, to churches, to mosques and everywhere, to ensure that we stop with campaign and bring the knowledge and the impact to homes and to families as well as to youth. Because some of these youth act out of ignorance. And as we have been told by clinical psychologists, some of them suffer from low esteem.
The better we work together, the better NDLA is well funded, well equipped to at least handle the main problem. If there are no drug barons, if the drugs are not sold, if we are able to catch them young, it will be better for this country. We are getting old. So what will happen to our children? Now, if we believe that because your own child is not into drugs, but your neighbor's child is basically your son.
Despite the onslaught against drug traffickers in Nigeria, drug abuse has persisted, with drug users adopting new unconventional psychoactive substances to replicate the effect of illegal substances like cannabis and cocaine.
So the abuse could come in any form. It could be underuse, it could be overuse, it can be using the wrong medication, it could be even getting the right prescription, but you got the prescription from a medical personnel, but the prescription wasn't right. It could culminate into an abuse.
So there's a very strong correlation because some substances in their own selves are depressants. For example, alcohol. The alcohol people drink socially, which is socially acceptable, is also a depressant. So some other substances too. Cannabis in some quantities are depressants also, although cannabis could also be hallucinogens, but cannabis could be a depressant too. So the neurotransmitters in the brain are gravely affected by these substances, and you know that the pathophysiology of depression is as a result of chemical imbalances. What these substances do is to alter the normal level of these brain chemicals, and this results in a change in the change of emotions of the substance users, and that's where depression comes in.
It is for this reason that the federal government is prioritizing prevention mechanisms with commitment to allocate adequate resources and foster partnership for greater impact on the fight against illicit drugs. Experts and government representatives are urging youths, other drug users, and traffickers in Nigeria to avoid drug abuse, as this is capable of altering their bright future.
Yes, I will tell Nigerian youths not to go into drugs because that will mar your future as a youth. You have the potential as a child or as a youth in this country to aspire to the highest level of political position. You have the ability to be whoever you want to be. People are millionaires today, like Dangote and Co. and Tedola and all these ones. You have the potentials to be one. You have the potentials to be a Senate president. You have the potentials to be a president of this country. Why destroy your future with drugs? Drug is something that will clip you forever and put you in perpetual misery. So get yourself out of it.
My dear young people, you see, it's important that we shun drug abuse and choose better alternatives to life. There are better alternatives to catch fun, to increase pleasure, to create pleasure, and to numb our pain, not drugs.
Experts are also of the view that parents should be mindful of the various signs that might indicate their child is involved in drug abuse. These include sudden behavioral changes such as increased secrecy, withdrawal from family activities, and lying. Academic performance may decline, and there might be a loss of interest in school or extracurricular activities.
But when you see them oversleeping, they're always drowsy, then you should suspect something is going on. When they become so irritable, you talk to them and on trivial issues they have anger outbursts, then you should suspect something is going on. So please be watchful.
They are emphatic that early detection and open communications are crucial, stressing that if these signs are observed, it's important to approach the child with concern and support rather than being judgmental and seek professional help if necessary.
The next report by Stephen Nwokolo is trying to put forward suggestions on how to mitigate drug abuse, starting with prevention through education and awareness campaigns. There is need to consider early intervention and treatment programs, as well as law enforcement and border control efforts. Over to you, Stephen.
Drug abuse is the harmful or excessive use of legal and illegal substances that lead to physical and psychological dependence and negative consequences on health, relationships, and the overall well-being of users, with ripple effects on society at large. Experts believe it often originates from various factors, which include underlying trauma and mental health issues or peer group influences. Many individuals also turn to drugs as a coping mechanism for unresolved trauma.
We need to bear in mind that this is one scourge that is threatening us menacingly and actually has the capacity to consume all of us. If we wear this consciousness and we have it at the back of our minds that truly that Nigeria is facing an existential challenge, then I am sure that both those who are in government and those who are not in government would give the fight against drug abuse their very best.
Traumatic experiences such as abuse, neglect, or witnessing violence can lead to emotional distress, and victims assume drugs may offer temporary relief from these feelings. Conditions like depression, anxiety, bipolar disorder, and post traumatic stress disorder can also contribute to drug abuse. People may sometimes use substances to self-medicate or alleviate symptoms, which can exacerbate the underlying health condition over time. Director, Media and Advocacy, National Drug Law Enforcement Agency, Femi Babafemi, speaks on efforts by his agency at mitigating drug abuse in Nigeria.
Drug dependence or addiction is not a walk in the park. It's not like what you just walk into and you say in another week you walk out, you come out of it. No, you only know when you go in. You may not be in charge to be able to determine when you come out of it. We have seen people who have spent 10, 20, 25 years struggling with substance abuse. Struggling with it. So, an average rehab facility in Abuja here, an average one per month costs like 1 million, 1.5. There are some that cost 2 million a month. So how many families can afford that? So that's why we call for prevention. That's why we call for early detection through testing.
Managing Director, African Alternative Medicines Hospital, Abuja, Professor Ben Amodu says he has allegedly produced drugs that can discourage the abuse of drugs in the country amidst the multifaceted approaches to mitigate drugs substances abuse.
In the medical parlance, drug abuse can be referred to as the hazard use of illicit psychoactive substances, which can include uh, alcohol and illicit substances. That is the definition. When you use it in a hazardous manner, you are said to have incurred drug abuse. And the hazard that is there means that you have used it beyond the proportion to achieve medical aims. Like armed robbers go to use certain drugs because they want to increase the threshold of pain. Well, I have done a lot of research in this area, drug abuse, and I have solutions for alcoholism that we can indoctrinate, then give our products, and on the gradual use of it, the child or the adult will gradually get out of it. And the effect is that if it's on our product, he's likely to have some hallucinations if he tries to go back to taking those things. And that hallucination will be so bad that the person wouldn't want to go back to test again. And it's the same way with illicit drugs like cannabis and cocaine. We have gotten some herbs that have the capacity to prevent them from taking these illicit products further.
The Director of Media and Advocacy, NDLEA, also speaks on promotion of awareness about the risk of drug abuse, impact on health, and the importance of seeking help early for mental health issues. This includes educational campaigns in schools, communities, and workplaces, while ensuring accessible and affordable treatment options for substance use disorder and mental health issues. This includes facilitating counseling therapy, rehabilitation centers, and support groups across the country.
As long as you are struggling with substance abuse, it's not about the youth alone. This is something that affects everybody, both the young and the old, male and female, worker, students, out of school children, all of them, everybody is involved. And all our programs cover all of these people. Yeah. If you look at the drugs, for instance, that are commonly abused in Nigeria, the number one on the list is cannabis. And cannabis has a lot of variants. You have the cannabis sativa, which is the homegrown one here. You have the one that is called loud. You have the one that is called colos, that's Colorado. Those are synthetic ones. They have been processed, usually or mostly imported from America and North America, especially Canada. Then you also have, that's the most abused. If you look at the 2018 drug survey report, um, which revealed that 14.3 million Nigerians abuse illicit substances, 10.6 million of that 14.3 actually abuse cannabis.
These respondents are emphatic that providing support services for individuals affected by trauma, such as trauma-informed care and counseling, will go a long way to help address underlying issues that contribute to drug abuse, distribution, and trafficking of drugs.
It does look like quite a vast majority of Nigerians still do not understand uh, what drug abuse is doing to our young people as we speak. We do not seem to realize that the future of this country is being endangered because, as we speak, a lot more of Nigerian youth are getting hooked on substances of different hues. And that means that tomorrow is bleak for us because drug abuse eventually would compromise the health, well-being of the individual who is involved in it. It will lower national productivity, and of course, it brings about strain within the family unit. What that also means is that the society now is in distress. So, drug abuse, it's something that hinders the progress of a society. It is something that leaves the society's security very vulnerable. It also poses very far-reaching health hazards to whoever that is engaged in it. So, if you ask me, federal government should declare a state of emergency on drug abuse. We need to realize that the various stakeholder groups have a responsibility individually to step up their games. Whether we are talking about NDLEA, whether we are talking about the Nigerian Police Force, whether we are talking about NAVDAC, whether we are talking about civil society organizations who are involved in creating awareness and sensitization programs, whether we're even talking about religious organizations and, of course, traditional institutions, because these are, of course, very obvious stakeholders in the fight against drug abuse.
Engaging communities in prevention efforts, peer support programs, and promoting healthy lifestyles must be prioritized to create an environment that discourages drug abuse. Deepening efforts towards investing in research on effective prevention and treatment strategies, as well as advocating for evidence-based policy that will guide comprehensive approaches to addressing drug abuse is sacrosanct.
We engage all these children coming out of school without any job doing, and tell them the bad effects of being on drugs and substances, and then instead of leaving them idle, try to give them supply chain in farming business so that everybody is engaged. An idle mind now is a devil's workshop.
We have Mkurumiri, we have Flaka, we have marijuana, we have Arizona, we have all sorts. In fact, it is a cocktail that our young people now take. Please, whatever it is that you're taking that is not prescribed by a medical doctor or a medical personnel, don't take it. Whatever it is that you do not ordinarily need for you to function optimally, please don't take it. And let me tell you, when you think that you're feeling high, oh, I want to get high, you are doing great damage to your central nervous system.
By addressing both the root causes, including trauma and mental health, and implementing preventive and supportive measures, Nigeria can work towards mitigating drug abuse and promoting the overall well-being of its populations.
Experts say fighting drug abuse calls for a collective effort from individuals, families, communities, and societies. They say it is pertinent to learn about drug abuse, their effects and risks, share knowledge with others, especially children and young adults, encourage and help those struggling with addiction to seek treatment, and promote health alternatives like engaging in sports, hobbies, and activities that foster well-being. Please do your part and report illegal activities by informing authorities about drug-related crimes or suspicious activities when you see them. Remember, every small action counts, and together we can make a difference in the fight against drug abuse. Thanks for watching. I'm Lydia Samson.